Hi, my name is Ty Hunt and I'm a physical therapist. And what I'm going to do today is I'm going to teach you guys how to perform dry needling. Not that you're going to be an expert, but I'm at least going to show you how to do it. So you may ask yourself, what is dry needling? Dry needling is similar to acupuncture. We use the same needles, but we have a different foundation of knowledge. Not that one's better than another, but we just kind of use it in different scenarios. What we use it for as physical therapists, we use it for musculoskeletal injuries. We don't use it for any type of systemic issues or any anxiety or weight loss or anything like that. So first I want to show you a few things that we use. First thing that we use is going to be our informed consent. We get every patient to sign one of these so that they know what some of the precautions, some of the problems that could exist from it. So initially we get them to sign. Some of the other things that we use that we have here are our electrical stimulation unit that we'll use, cotton balls to help clean the skin wherever we're going to do dry needling, obviously the needles, rubbing alcohol, and of course my gloves that I'm going to use. So while I'm putting on my gloves, I'm going to tell you a little bit about the needles. The needles are very thin. They're 0.3 gauge, so they're not very big around. Actually, the needles that you get immunizations in the doctor's office typically with is a 18 gauge needle, so my needles are significantly smaller. And they vary from 1 inch all the way up to 6-inch needles, depending upon the size of the individual, the treatment dose that you want to perform on the patient. So what we're going to do today is we're using 1-inch needles. And before I go any further, I want to say thank you to my daughter for running the camera for me today. We already did one take and I needled her with a 1/2-inch needle and she didn't care for it. I decided to needle myself. So we're just going to needle my quad here as if I had pulled my quad, and I'll open up the needles here, get them going, and we're only going to do 2 needles today in my lateral quad. Sometimes, depending again upon the person and the treatment dose, we could do upwards of 6, 8, 10 needles. So the needles are contained in the sheath. This is the needle here. Maybe you can kind of see it on the background of my shirt type thing. Not very thin at all. And actually I have a 2-inch needle here. So, but basically what we do is just set it on the skin, kind of tap it to get it started, and then we just insert it, and occasionally we'll get some twitching there. So there's one. Now we're going to do a second one. And there we have the needles inserted. And then I'm going to attach my little alligator clips for the electrical stimulation piece. And if we do this just right, we may be able to get a muscle twitch. So we hook that directly to the needle as it's in the muscle. We do this one to the other side. And now what I'm going to do is turn it on. And this part is pretty much, we turn it up to patient tolerance. So I feel that twitch, but it's not a painful twitch. If I turned it up much more, then yes, it would be painful. So this is dry needling. Session lasts 6-7 minutes. And when we get done, we have the patients do exercise and some stretching. We don't like the ice, because one of the things that we're doing here is getting blood flow increased. So we want patients to go out and do their normal thing. Okay? Thank you very much for being with me for needling today. Hope you guys enjoy it. Talk to you later.